From Agence France-Presse, the World Health Organization said this past week that more than 100 million people are plunged into poverty every year by illness or catastrophic medical bills, launching a global drive for universal health care. The organization's Director General, Margaret Chan, presenting the report in Berlin, said, quote, "In my view, universal coverage is an admirable goal and a timely one. We have to bite the bullet." The agency's annual report, devoted this year to financing health systems, underlined that the need for universal health coverage has never been greater with the economic slowdown, globalization of disease, and aging populations that need more care for chronic conditions. Chan warned, quote, "If health systems do not find the right answers now, the bill further down the line is going to keep getting higher and bigger." Since 2005, the WHO's 192 member states have decreed that everyone should have access to health services and no one should suffer financial hardship as a result. The UN Health Agency found that in countries that depend heavily on people paying for their services when they seek care, quote, "health bills push 100 million people into poverty each year, as many suffer catastrophic costs." The report says the most successful healthcare systems in Europe, Japan, Chile, Mexico, Rwanda, and Thailand were based on pooled resources, helping to spread the financing burden.
It's certainly been a problem that hospitals and providers have to make money, and often by prescribing medicines or tests. And I think that getting the payment mechanism right for hospitals is going to be important. But I think also as more people are covered by insurance, the incentives or the pressures to do that are going to be less. But it's certainly going to be a challenge over the next few years.
Although the poorest countries are the hardest hit, the report also underlined that disparities even within some of the richest nations also harmed care. The report cited a study by Harvard University in 2007 indicating that medical bills contributed to 62% of family bankruptcies. David Evans, Director of Health Systems Financing at the WHO, said, quote, "It's just not acceptable, and it is not only not acceptable, but it's not necessary, because something can be done about it."